Okay, so welcome everyone and good afternoon. And so it is my pleasure to share my topic about the difference between psychology, counseling, and psychotherapy. Okay, so I believe that all of you intend to study psychology and you may have those questions in your mind. For example, you may want to help people with emotional problems, especially during this COVID period. A lot of people are suffering from different kinds of emotional problems. And there are also so many different programs in psychology and different pathways, and then you may have no idea which one to choose. So in this seminar, I will talk about how to select the programs that match with your goals. And some of you may want to engage in mental health sector and get into the pathway to become a clinical psychologist or a counselor or some other mental health specialist. And apart from those traditional pathways, such as getting into the program of clinical psychology or counseling, so what else can you choose? And for me, I didn't get into the program of clinical psychology and counseling, and instead I got into the PhD program in psychology, and I am now practicing mindfulness-based interventions for people who feel stressful in workplace. So I will also share my unique journey later. Okay, so I start with the definitions of psychology, counseling, and psychotherapy. So basically, psychology is about the study of human minds and how human mind works and how our mind will affect behavior. And then counseling and psychotherapy are a bit similar, but I will later show you the difference between counseling and psychotherapy. And both of them involve some kind of professional help, um, in which when you have some mental or emotional problems, then you may have one-on-one session with a counselor or a therapist, and then they will provide some kind of mental health treatment. To illustrate the difference between those terms graphically, and basically, there are two kinds of programs in psychology. So for example, you can get into the research psychology program such as MPhil or PhD program. And during those years in the program, you will conduct different researches in psychology. You may examine different theories or hypotheses. And some of you may be more interested in applied psychology program in which you may not have to conduct intensive research, but instead you will learn some concrete skills about how to conduct counseling sessions or psychotherapy sessions. So I believe that most people are more interested in applied psychology program more than research psychology program. But it doesn't mean that research psychology is useless. Instead, research psychology will uh, establish very important theories and research findings that can really provide the theoretical foundations for counseling and psychotherapy. So, in case you would like to get into the mental health sector, what comes to your mind is maybe clinical psychology or counseling. And I would like to share one important point that there are different kinds of target group, and some of them may have mental disorder, some of them may have some mild or moderate problem, but they don't really have mental disorders. And for those people, they may struggle about whether or not to seek service from clinical psychologists or from counselor, because they may not feel that they have the need to visit those mental health professionals, but they would also like to seek help from some other channels. So, and there are two kinds of approach in mental health service. So for those with mental disorder, they may have to seek help from clinical psychologists or counseling to cure their disorder. But if they do not have disorder, they can also get some other mental health service. So before it is too late to seek help, they can still get into some other activities or some other classes to prevent mental disorder from developing. So that's why there are two major types of mental health service. And many of you may just think about clinical psychology or counseling offered by registered professionals. And in addition to clinical psychology and counseling, and there are in fact many other mental health services offered by certified or experienced practitioners. So in case you would not like to get into the pathway of clinical psychology or counseling, there are many different options if you would like to serve people and have people or bring happiness to more people. So for example, there are mindfulness interventions. I'm not sure how many of you have heard about mindfulness meditation before. And mindfulness meditation is getting more and more popular in Singapore, and there are a few centers, a few professionals offering mindfulness classes in Singapore. And I also find that there are some other additional therapy not offered by clinical psychologists or counselors. So you may have heard about therapy with arts, with music, or with dance, or with other sports. And typically, those therapy with arts, music, and sports are offered by coaches or practitioners with specialized training. So there's many different types of mental health services targeting on different individuals with different situations. So I would like to introduce 5 major types of mental health professionals, and they have different backgrounds, different durations of trainings, and they also have different specialized jobs. So I will introduce one by one so that you can know the difference between them. So first of all, many people have confusion between psychiatrists and clinical psychologists. And in fact, psychiatrists will have medical background instead of psychology background. And usually they treat mental illness using some kind of medicines or biomedical approach because they are well trained in the medicine background, and they are very good at prescribing medications for people with mental disorder. And so typically they have to undergo bachelor training in medicine or surgery, and then they have more specialized training under the master degree in medicine. That would take more than 11 to 13 years before they become a registered psychiatrist. So if you want to be a psychiatrist, then you should follow the pathway of medicine training, but not psychology training. And then if you would like to be a clinical psychologist, then you will undergo the training. You must have the bachelor degree in psychology, and then you must also enroll in the program of master or doctoral degree of psychology with specialized clinical psychology training. So usually clinical psychologists are responsible for diagnosis. So they will have a very formal assessment of individuals whether or not that person have mental disorder or not. And then they would also be responsible for offering psychological treatment of more severe mental disorders, such as severe depression or schizophrenia or personality disorder. Because for other mental health professionals, such as counselors or coaches, they may not have the competence to provide treatment for people with severe mental disorders. So clinical psychologists are well trained to treat those people. So that's why they also need many years training, at least 8 to 10 years, before they can be a registered clinical psychologist. And then some of you may want to become a counselor, and usually they offer help to people with moderate problems in jobs or in relationships. For example, they have very huge fights with their boss or with their partner, and they would like to seek professional help from a counselor, because the counselors are equipped with different psychological tools that can really address specific problems. So they may seek help from counselors instead of clinical psychologists. And usually those people with moderate problems in jobs or relationships may not have mental disorders. I just have some fight with my colleagues or with my partners, but I have no idea how to solve the problems. In this case, I can have a consultation with a counselor to see which kind of tools I can adopt to solve the problem. So if you would like to be a counselor, then at least you must have a bachelor degree in psychology or in social science, and then you get in the master degree in counseling. And after supervisor practice, then you can register yourself to become counselor. So it takes about 6 years, starting from bachelor degree the to the end of master degree in counseling. And then for those people who would not like to be a clinical psychologist or counselor, then they can also offer specific therapy depending on what kind of specialized protocols they learned to offer. So there are so many different specialized tools or protocols for them to learn. You may have heard about family therapy, art therapy, music therapy, dance therapy, and mindfulness-based interventions are also one of the protocols that they can offer to people, so they can really learn about how to address their problems using mindfulness meditation. So under those specialities, they usually have a graduate diploma or a bachelor or even a master degree, and then they get into different specialized training courses. So for example, for those who would like to be an art therapist, then they will get into specialized program that can train themselves to be an art therapist. And then if they would like to be a teacher of mindfulness-based meditation, then they will also get into the specialized training courses to train them to teach mindfulness meditation. But usually when they offer this kind of specialized therapy, they should have some background knowledge in psychology. So that's why they will learn psychology from a graduate diploma, or they may even have more trainings in a bachelor or master degree programs. Of course, the more training they have, the more solid foundations they have when they offer the therapies. And then you may also heard about some other enrichment classes and workshops and activities. For example, during high school, you may have joined some outward bound programs or some classes such as Tai Chi or Judo or some other classes. They are offered by specific coaches or teachers. They may not have very good educational background, but they are very professional and experienced in Tai Chi or those activities. And those activities are also very important in preventing mental illness. Yeah. So you can see different kinds of mental health services. So some kind of services focus on curing mental disorders, and usually those are offered by professional clinical psychologists or psychiatrists. And there So different people serve different roles actually. So for example, coaches and teachers will offer enrichment activities to reduce the onset of mental illness. And then for those people who have moderate or mild strugglings or problems in their jobs or relationships, then they can get into different classes or different therapists, or they may seek help from counseling. And those with severe mental illness will be referred to psychiatrists or clinical psychologists. I would like to show you this graph to illustrate different target groups and how different target groups are served by different mental health professionals. So, according to some news report or some informal survey, about 10 to 12% Singaporeans suffer from mental disorder at least once in their life. And so there are a few proportions of people with mental disorders, and they have to seek help from psychologists or psychiatrists. But many people suffer from some mild or moderate problems, and they do not yet have mental disorder. So I'm not sure if you have personal experience of that. So, for example, I feel very stressful at work, or I have some problems. I have no idea how to deal with my own emotional problems. But I don't really want to visit clinical psychologists because I don't think I have mental disorder, and I'm scared of being stigmatized, of having mental illness. And in this case, what kind of services I can have so that I can help myself, I can have some other activities or class for me to reduce my stress. Yeah. So here you can see how different roles actually work together. So you do not really have to be clinical psychologist or psychiatrist in order to offer mental health services, because there are different roles, offering different help to different people. And if you would like to offer psychotherapy, and again, you do not have to be a clinical psychologist in order to offer psychotherapy. So you can be a counselor, you can be an individual therapist, as far as you are trained to offer that specific psychotherapy, such as CBT or ACT, then you can already offer this kind of therapy to general public. And in fact, psychologists in Singapore are not regulated by the government, not regulated by the Ministry of Health. So so it can be an advantage or a disadvantage. An advantage is that anyone in Singapore can offer psychotherapy to different people. Although the psychologist may not be licensed or registered with a government agency or professional board. And in case you would like to seek help from a psychologist, of course, you can ask that psychologist what kind of training he or she had. You can seek evidence of that person's ability to practice. And then for employers, they can also ask job applicants to show their past trainings in order to decide whether or not to hire them. I believe that more and more people are interested in getting in the mental health sectors, especially during this period of COVID-19. And the impact of COVID-19 is not limited to physical health, but it also has impact on mental health. when you are trying to search for different newspaper articles about the impact of COVID-19 on mental health, you can find quite a lot of news from CNA, from BBC, from insurance business. And you may realize that COVID-19 has a very large impact on mental health, and we should not underestimate its impact. Because if we ignore the impact on mental health, then more and more people will develop mental disorder, and it may be too late to seek help. And I believe that all of you have direct experience of those impacts. Our lives are really affected by different restrictions, such as restricted social gatherings. So we cannot really meet with our friends or family members. So there's also restricted entertainment. When I'm feeling stressful, I cannot reduce stress by watching movie or by having a drink with a friend. And I also cannot travel to other places to make myself happier. And even worse, I may suffer from job loss or income loss. I may not be able to afford expensive service from clinical psychologists because when I seek help from clinical psychologists, one session costs more than $100. I cannot really afford that. And those restrictions have very huge impacts on emotions. So especially when this impact lasts for a long time, for more than 1.5 years, many people have been suffering from those emotions. They feel lonely, especially when they cannot really meet with other friends or other people. And then they may feel depressed or hopeless. They have no idea when this pandemic will end. And then they may be worried about job loss or income loss. They have no idea if they will be fired tomorrow. So there are huge impact on emotions. And at the same time, there is growing demand for mental health services. So they really want to seek help from mental health services. And when they want to seek help from mental health services, again, they have these questions. They have no idea where to seek help. Should they receive psychotherapy? Should they visit a counselor, or should they go to other place to seek some other source of help? So here I would like to share to you different kinds of interventions in case some of you do not know. And when we talk about mental health services, what comes to our mind is those traditional intervention. So we think that mental health service is limited to therapeutic or counseling session. When I feel sad, I can only visit psychiatrists or clinical psychologists or counselors to have one-on-one sessions. In fact, there are many contemporary interventions. So in case you feel sad but you do not have mental disorder, there are many other options for you to choose. For example, there are some stress reduction workshops, and they will teach you some skills about how to relax your muscles. Then there are classes of mindfulness meditation in which you will just sit and meditate. And there are also other online lectures or other talks, and you can also learn some simple skills or some straightforward theories about how to understand the linkage between unhappy emotions and thoughts and body sensations. And then some people may also download some mental health app in case they would like to help themselves through the procedures and guidance of those mental health apps. And those traditional interventions are typically offered by psychiatrists, clinical psychologists, or counselors, and so they must be licensed or registered so that they can offer those intensive therapeutic sessions. On the other hand, those contemporary interventions are offered, can be offered by many other professionals. They can be offered by therapists, by coaches, by leaders, mentors, or consultants. So they may not really need very professional background, but they may be very experienced in meditation. They are very experienced in dance or art practice. Then they can really um, have offered those other options for people who suffer from stress or other emotional problems. That's why different professionals, different practitioners have offer service for different target groups. So for people, for patients or clients with severe mental disorders, then they are better served by intensive counseling or therapeutic sessions from those professionals. But for general public who have stress, who have emotions problems, then there are some other options for them, and usually those options are easily accessible and cheaper, more affordable. For example, when you attend mindfulness meditation class, then the hour rate is about 25 or about $15, something like that. So that is much more affordable than having a therapeutic session with a clinical psychologist or counselor. Okay, so here I would like to share to you some career options in mental health. And after you are trained to become a mental health professional, then you can be a full-time staff in educational or health-related settings, or you can be you can practice as independent therapist or consultant or coaches or teacher. So the major difference between them is that when you get a full-time job in an organization, then you serve clients in that organization that hires you. So that would be very stable. You just stay in the same organization, then you get a fixed amount of salary from that organization. And some people may prefer independent or private practice because that is more flexible, and their clients are not limited to one organization. They can serve clients in their own organization, and then they can also look for clients from other places. In addition, they can also accept temporary employments from different schools, different hospitals, different organizations, different centers. So they can reach so many different people, and they can have different sources of income as well. And some people may not really prefer this mode because the income would be quite unstable. It depends on how many clients they can get. But their income can be more than some full-time staff actually. If they are very experienced, if they have a huge base of clients. So here I would like to share to you my background. So my journey is quite unique because I didn't get into the program of clinical psychology and counseling. So instead, I got into the PhD program, which is research psychology program, and in which I conduct research and submit a thesis and get the PhD degree. And in addition, I am trained to teach mindfulness-based stress reduction and mindfulness-based cognitive therapy. Okay, so I can also share to you the timeline of my pathway, how many years of education and other trainings I went through. And I got into the bachelor in psychology in 2003, and then after that I had 2 years of MPhil in psychology, and then I got a job of lecturing in an institution and then I get into the PhD in psychology. And during the PhD period, I also learned about mindfulness meditation because I find it very helpful to reduce my stress during the PhD period. And I feel that mindfulness meditation is really helpful. So I'm also determined to teach mindfulness to general public. So I got into the specialized training course so that I can teach mindfulness to general public. So after I graduate, I practice independently. I didn't get a full-time job in any organization. Instead, I accept jobs from different institutions and different organizations, in which I teach psychology courses in some institutions. And in addition, I also teach mindfulness classes in different activity centers. So my income is sort of quite unstable, but that is the mode that I really enjoy. Although my income is unstable, I can have more flexible time in which I can really arrange the work period, and then when I would like to take a break for myself to develop my spiritual life, and then I can also take a break to attend meditation retreat. If I have a full-time job, then I cannot really take a break for maybe 2 or 3 weeks for meditation retreat or for vacation. So that is my own decision. So that's why I am offering mindfulness-based cognitive therapy and also mindfulness-based stress reduction. And my target group is more for people who are bothered by recurring negative thoughts and they do not have mental disorder. So quite a lot of people have struggles about their negative thoughts. They may feel very bad about themselves. They may be quite pessimistic. And at the same time, they do not have very severe mental disorder. They do not have clinically diagnosed anxiety and disorder. And in this case, they can really benefit from mindfulness-based cognitive therapy, in which they gain more awareness of their thoughts, emotions, and body sensations. And then there are also specialized tools for them about how to get through those patterns, those thoughts and emotions. And then there are also many people who suffer from high level of stress. They have very long work hours, and they have no idea how to reduce their stress. And that's why they can really benefit from mindfulness-based stress reduction. So my target group is more for general public without mental disorder, and then in the mindfulness-based meditation classes, they come into the classes by group, in which they do not really have to share about their personal issues. They just come to the class and then learn how to meditate by sitting or walking or eating, and then they do not really have the concern about stigma or discrimination. And it sounds perfectly normal when you attend a class to reduce your stress rather than seeking help from a clinical psychologist. And I also feel less stressful because I am not dealing with people with very severe mental disorder, and that is the work I really feel enjoyable, and that really fits my personality because I don't think I can really handle those people with very severe problems. So that's also my limitation. So I get into this pathway and offer this kind of mental health service. So some of you may be quite interested in whether I can make a living from that without a full-time job. And I can also share to you my experience about the pay rate actually. And it is not fixed, and it depends on the number of students and teaching hours. So I receive different contracts from different centers, organizations, and institutions. And some institutions or some organizations offer a high pay rate, and some offer lower pay rate. And the range is from $70 to $200 per hour, and the average is about $120 per hour. And then I can also share to you the teaching hours. So that is my personal experience, and other people may have higher or lower teaching hours during school terms and summer holiday. And the teaching hours include my lecturing classes in educational institution, and also my mindfulness meditation classes in different organizations. And usually I teach about 15 hours per week during school terms, and about 8 hours per week during summer holiday. And so I feel that it is enough to maintain my daily expenses. And I do not really have to work for so many hours. And those teaching hours do not include my preparation work. Of course, before I teach, I have to spend quite a lot of time to prepare, especially when I'm going to teach some new classes that I'm not familiar with. But that is the reference for you in case you like to practice privately or independently. You do not really have a full-time job, then that is the reference for you. Okay, so at the end of this session, I would like to share to you some common misperceptions about mental health services. Yeah. For example, when you have emotional problems or when you feel stressful, some people may think that they can only seek help from a psychiatrist, counselor, or a clinical psychologist. Instead, when you feel stressful, you can seek help from many different kinds of professionals. You can seek help from a coach, from a dance therapist, music therapist, or meditation therapist. You can also seek help from a teacher, consultant, mentor, or your leader, etc. So you do not always have to visit a psychiatrist or a counselor or clinical psychologist. So those are only some few options. Another misconception is that psychiatry, counseling, and clinical psychology are the only effective interventions. They think that all other interventions are not effective or not reliable. So, for example, they may think that music therapy is not reliable, or meditation is not reliable. They only trust psychiatrists or counselor or clinical psychologists because they have they have to be registered with professional board. And what I would like to share is that effectiveness depends on many different factors. So it depends on the characteristics of clients. It also depends on the quality of therapists. And personally, I know quite a lot of therapists. They are not clinical psychologists, not counselors, but they are very mature, very experienced in offering mental health services. And they also have many years of training and experience, and have very high education level. So it really depends on the quality of therapists. So some therapists who do not have very good educational background can be very good at healing. And then one last misconception is that when I would like to offer help for people with psychological issues, some people may think that they can only enroll in counseling on clinical psychology program. that was also one of my misconceptions when I was undergraduate. But now I realize that having a degree related to psychology is very basic. I will highly encourage those who would like to get into mental health service to get at least one degree related to psychology so that you can learn about the basic theories in psychology. That would be very helpful when you offer different kinds of therapy or services to other people. But what further training you get really depends on your personal goals. So for those people who would like to have a secure job, then of course they feel more secure when they get into counseling or clinical psychology program. But at the same time, those programs are quite competitive and very few people can actually get into those programs. And at the same time, they would like to practice as a psychologist or therapist, and then they can have some other training. They do not really have to enroll in counseling and clinical psychology program. Yeah. Okay, so I think that's all of my sharing, and here comes to the Q&A session.
Dr. Yip, I think there's a question here in the chat earlier.
Oh, I didn't see.
Yes. So someone is actually asking with regards to how different are the responsibilities outlined as compared to the occupational therapies. I think it was based on one of the slides that you shared earlier of the different, roles and the rest. Yes, I believe this is the one.
Can you repeat? May I read the question again?
Okay, so the question is how different are the responsibilities outlined here as compared to occupational therapists?
Oh, yeah. So for registered psychiatrists or clinical psychologists or counselor, because they have to register themselves with some professional body, then in case you have complaints or dissatisfaction, then you can launch your complaint to those professional organizations. And then for therapists, coaches, leaders, or consultants, when they are hired by an organizations, then you can also launch your complaint with the organizations. But for therapists or some consultants who practice individually or independently, then I don't think you can launch the complaint with any organizations because they are not hired or not monitored by any professional boss. And I believe that when they have to develop their reputation, then they of course they would not want to damage their reputation, and usually people who would like to launch a complaint may only share their complaints on some discussion board, and yeah, they are not registered or licensed by the government. Yeah.
So, Dr. Yip, I believe there's also another request here asking whether you can actually show the chart on the different roles that was shown at the beginning of the webinar.
Different roles. Here, which one? This one or which one?
Oh, it's slide 3. Slide 3.
Oh, slide 3. Okay. Yeah. Okay. The definitions.
Would you mind just go through the difference between the counseling and psychotherapy again?
Oh, okay. Oh. Okay, so in general, counseling is short-term and psychotherapy is long-term, I would say. So counseling deal with specific problems. For example, when you have arguments or conflicts with your boss or partners, then there then counseling will offer some sessions so that you learn how to get along with other people. And psychotherapy usually deals with more deep-rooted problems with more complicated causes. They may have to address their childhood difficulties or trauma, and usually psychotherapy would be longer and require more specialized and professional training, so that you can offer that kind of psychotherapy.
They not necessary to be a psychiatrist or, you know, with the kind of degree to be playing as a role as a psychotherapist.
So there is no such term called psychotherapist. So for professional roles, they can be psychiatrists, they can be clinical psychologists, they can be counselors, and yeah, but psychotherapy can be offered by different professionals as far as you are trained to deliver that particular therapy. So for example, when you are trained to deliver CBT, no matter you are clinical psychologists or counselors or consultants or other therapists, then you can really offer that particular therapy within your scope of competence. And again, psychologists are not regulated. So as far as you feel confident to offer this particular therapy, then you can just offer that therapy by yourself. And of course, your clients may ask or request how competent you feel about yourself to practice that therapy. Then you may have to show your previous training, educational background, so that they trust you more.
Okay, so it's not referring to a specific role. It's more of a method of helping people with mental health issues.
Yeah.
Okay.
Yeah.
Okay, thanks.
Dr. 𝗟𝗶𝗸𝗲, this is Dee here. I was just wondering if I've just been a therapist, would you encourage me to continue getting onto a counselor level and then a psychologist, or would therapists or becoming a counselor be sufficient enough to say help people if they are in need, basic ones like simple stress problems reduction or whichever that comes along the way? Of course, severe, I don't think we are apt enough to counsel the person, right?
Yeah.
We should be recommending them to psychiatrists or whatever, the psychologists. But as a basic therapist or counselor, what are my limitations? I mean, how far can I take this in terms of joining say my own, if I wanted to open up a school for counseling or just to be able to guide people, would that be enough or sufficient being a counselor?
So I think it depends. It really depends on your personal goals. I would say if you would like to offer some kind of therapy, then I heard that some therapists will have some other specialized training instead of getting into any formal program such as counseling or clinical psychology program. And they also have a lot of students, and they sometimes share their sessions on YouTube and get a lot of audience and more and more students get to them. So, and of course, if you have counselor or clinical psychology degree, it would be easier for you to get a full-time job in an organization, because I see that many organizations are hiring full-time clinical psychologists or counselor, and they have less job offer for other therapists without so-called formal educational training. Yeah. But so for those therapists such as me, they usually practice independently or privately. So for example, I am working with an organization, and that organization will have different courses or different classes that can enhance mental health, and they refer students or classes to me, and then I'm responsible to teach. And then I also receive job requests from elderly centers or teenage activity centers, because they find mindfulness meditation really helpful for them to learn how to reduce stress, how to notice their emotional problems. So
yeah, it seems to be like the in thing now, this thing called mindfulness coach or mindfulness guru. What's your take on it? I mean, is that something very relevant for today?
Yeah, so because this session is not about mindfulness meditation, yeah, so but I can speak more shortly. Yeah, mindfulness meditation is about focusing on the present moment, like focusing on breathing or body sensations or some different kinds of movement. And yeah, so those are the two versions of mindfulness-based interventions. Then you can learn about it online by searching those terms. And my target is more about general public, not people with mental disorder. So it really depends on what kind of competence you would like to develop. And if you have more training, or if you are more experienced, then maybe you can also work with those with mental disorder. But if you do not have professional background, such as psychiatrists or clinical psychologists, then then you cannot. So, for example, if you are not clinical psychologist, then you cannot provide diagnosis. Yeah. So because diagnosis is specialized by clinical psychologists.
Sure.
Yeah. So those are the limitations. Yeah. So but you can also offer psychological treatment to people with mental disorders, depending on your scope of competence, because there is no regulations by the government. As far as you feel competent to offer those treatment, then you can proceed. Yeah. I would like to say thank you to all of you who are interested in studying psychology or offering help to people, especially during this COVID-19. All of us are getting through a very difficult period, and I believe that more and more people would learn about psychology and mental health, and because those are the aspects that many people would like to learn how to help themselves and also other people.
Hi everyone, thank you for tuning into this webinar. We know for sure this skill will go a long way, so if you have any questions, feel free to drop them in the comment section below. Don't forget to like, share, and subscribe for more webinar replays. See you again, bye!